My hobbies mainly consist of playing video games with my friends, spending as much time with my friends as I can, as well as my family. I do work a lot, but I do love my job.
911, what is your emergency?
I work as a full-time 911 dispatcher, where I am currently a supervisor. I've been a dispatcher for the last 5 years. I grew up in emergency services with both of my parents doing it. It's definitely been an interesting transition going from more of a caregiver side to a patient side of things. I'm used to seeing and talking to patients every day as part of my job and hearing what they have to go through, but going through it myself now has given me a whole new perspective, seeing how it is to be a patient and live through some of the daily struggles that they've had to live through. My name's Hunter. I'm 23 years old. I was diagnosed with Desmoplastic small round cell tumor, and I live in Missouri in the United States. I got diagnosed whenever I was 21. I'm sure everybody can think of what every 21-year-old would rather be doing than fighting cancer, but I've tried not to really look at it as I got robbed of my early 20s, more of I got a lesson to teach me how to live a better life so that I can live the rest of my life the best way that I can. It really only took 1 or 2 days of not feeling right to finally decide to go to the emergency room and get checked out. And it all really started around November 2023. We had just come back from Halloween festival a couple of towns over, and the next day I had started feeling some pretty sharp abdominal pains, which wasn't really normal, but I kind of just thought it was a stomach bug and I could sleep it off and it wouldn't be anything. Then the next day the pains got worse and started to include some nausea and vomiting as well. And as that worsened and went on through the day, I ultimately decided that night that it was time to go to the ER and get checked out because something wasn't right. And so it was during then we discovered that I had a rather large mass growing in my abdomen and a smaller mass in my pelvis. While we were at the ER, they didn't have an exact answer for what they were looking at because they weren't sure at the time. So we were referred to KU Cancer Center for a biopsy and further diagnosis. We visited the doctors at KU and got a biopsy scheduled, and from there we were kind of just trying to put the steps in place for what we were going to do next in this process. It wasn't until we got the biopsy done and a port placed in my left shoulder that we found out I was dealing with actually a rare type of cancer, and then I was referred to the specialist that they have at KU. So when I first got my diagnosis, there's actually kind of two parts to that story. Was the initial findings in the ER when they had to come in and break the news that I had my tumor. It was actually a little interesting because my mom, who has been a nurse for years and years and seen everything, was a little bit of an emotional wreck, and my knee-jerk reaction in that situation was to try and make things funny. So I was trying to make jokes out of the situation while it was a rather serious topic at the time. I was doing my best to make light of the situation and keep a positive outlook. It was until about 2 weeks later, a week after my biopsy, that we had received the official results, and I was actually with my best friend at the time, and we were in my basement when I got the call from my doctor. And I remember we rushed up to my mom to see what the news was, because at this point we were thinking it was a more controllable cancer, such as a testicular cancer or like a lymphoma or something like that. But I took the news with my best friend and my mom in the room that I had what's called this desmoplastic small round cell tumor, and that I have a Ewing sarcoma genetic trait to it as well. So it was a little difficult finding out that I had such a rare disease, and of course, we didn't know nearly anything about it at that point. We had never heard of it before, like most people haven't. And so the more that we were researching into this, the more worrisome it really became, because um, Google will be pretty straight to tell you some sad statistics. It wasn't long after my diagnosis that my doctor at KU was on the phone with me, talking about the treatment cycles that I was going to be on. Um, he didn't give me a lot of options, but that's just because there weren't a lot of options to effectively really fight this. So I was put on a pretty rigorous chemo cycle that did quite a bit of damage for a while, but I had switched around between a few different treatments, and been in and out of hospital for transfusions, IV antibiotics, a multitude of different hospital stays throughout the night due to complications just with chemo alone. And, I was putting my body through all of that, but I just had to keep thinking to myself during that time that there was an end to it and that there was a reason I was doing all of it. So the overall treatment plan was to hit it early with chemo to hopefully shrink any tumors, to go in and remove those tumors surgically, and once those tumors are surgically removed and they can no longer see or detect any disease on scans, they went ahead and did a whole abdominal radiation therapy as well as a clinical trial. And over the years, all of those treatments just added up and got me to where I was today. But yeah, 3 different surgeries, the radioimmunotherapy trial, a month of standard radiation or traditional radiation, and then chemo on top of all of that, and then finishing it off with a maintenance chemo. The main goal of surgery with this type of cancer is called a debulking surgery. And to my understanding, that's where they really just go in and try and remove any physical mass that they had seen on scans that they can physically get a hold of. And once those are removed, they try and target that area with a traditional type of radiation to kill any residual cells that were left over. And so far, they think that that's the most effective treatment plan for desmoplastic small round cell tumor, is to hit it early on with surgery, followed by a traditional radiation treatment. And there are also many other trials offered with this type of cancer that patients have access to. The clinical trial that I took place in, I apologize if I don't remember everything to detail, but it was a radioimmunotherapy that was offered by Dr. Slotkin's team at Memorial Sloan Kettering in New York City. And to basically simply put it, they had surgically removed the masses from my abdomen and sent a radioimmunotherapy fluid into my abdominal cavity to basically sit there and absorb over a few days. And that would hopefully mark the targeted cells for radiation to be killed later on during the traditional radiation process. So with the clinical trial, I also had my third and final exploratory surgery where they were just going in and cleaning up any scar tissue or anything else left behind and making sure I didn't have anything else growing. Um, After the clinical trial, they followed up with a month of traditional radiation. So we were actually living out of the Ronald McDonald House in New York for about a month straight while I received radiation treatment. My maintenance chemo was scheduled for about a year. We started around January of 2025, and at around January 2026 is where I'll hopefully be wrapping up. I don't know exactly how many treatments I've had, but it's been every 3 weeks pretty consistently. So once or twice a month, I'll go in for a week of chemo and then have 2 weeks off. So the cycles are definitely up there. I've kind of stopped keeping track after so long, but hopefully wrapping up soon. We're actually hopefully planning a final trip out at the first of the year to plan a sort of a remission trip and ring the bell out there and have my remission start in New York, where all of my big medical journey started. A lot of the side effects that I first experienced when starting chemo and treatments was the nausea and vomiting was relentless. There wasn't really anything I could do to stop it. There wasn't a medication I could take to stop it. Nothing would really help. Food smelled different. Food tasted different. The only thing I was really able to actually help get my nausea under control was peppermints, because peppermint oil is supposed to naturally help soothe the stomach and treat nausea. So everybody would chip in and help buy me peppermints whenever I was doing my chemo weeks, because they knew that was the only thing that really helped keep me from getting sick. I have experienced hair loss. I'm luckily able to grow my hair now, but my first chemo was pretty quick to take the hair out of my head whenever I started it. So I was rocking the bald look for a while, but luckily I feel like I look a lot better with hair, and I'm able to grow some on my maintenance chemo. I'd say the biggest challenge is probably trying to feel normal after getting through it all again, because you spend so long in and out of the hospital, in and out of doctor's appointments, getting tested. People are asking how you're doing constantly, and it's something you constantly have to be aware of is, how am I doing? I actively have to be watching everything that's going on with my body and paying attention to everything that my body's telling me. But I've learned to, stop worrying about it so much and kind of take it day by day, and not necessarily be so anxious about every little thing that's going on, and just getting back to the normal side of life. Early on, it was made very clear to me that I wasn't going to have any problems finding support in my community. They really stepped up and were able to um, take the times out of their day and their lives to, make sure that I was doing okay during my treatment weeks, and check on me and make sure I had everything I need and my family had everything I needed. I was also very lucky that I have the friends that I have that were able to support me through it, and I wouldn't have been able to really get through it all if it wasn't for how well work treated me during all of it too. They allowed me to keep my job during it while I was sick, and they kept my seat warm for me for whenever I was ready to come back. Survivorship probably for me means, for me it means finding kind of a higher purpose, something that I'm more meant to do. For me, that's helping others. I've found a lot of um, comfort in doing that, which is something that I already had comfort in doing, but it's really re-solidified that after going everything after going through everything that I've gone through. Survivorship for me kind of just means advocating for others, moving on, and not staying silent and finding a voice, not only for myself but for others through things like this, because it's not always easy to find yourself while you're going through it. So I'm actually in a couple of support groups online for DSRCT, and one of the things that they say is hope always. And that was something I had never really heard until I started interacting with that group of people. But hope always has always meant to me that, really no matter how grim things look, all you can really do at the end of the day is hope. Um, because if you don't, who will? Somebody's got to, have a little bit of hope in that situation. And I've had my hopeless days, but I've never let hopelessness consume me. I've always tried to find at least one positive out of any bad situation to try and take away from it, to kind of give myself a different perspective. I don't think anybody should go through this silently. They should absolutely fight cancer kicking and screaming, because that's how cancer tries to take you down. That's how you should try and take down cancer. So I think finding a voice and being able to tell your story as a survivor and a patient is important, to not only help give hope to others, but to also just be a peer to other people. I don't want it to be such a hard thing for people to talk about. I want people to be able to talk about it more openly, because when we talk about it openly, we can start tackling, I feel like, a lot of the problems that don't get talked about enough. Patient advocacy is one thing that's really important for me. Definitely after going through our own struggles with the American healthcare system, I definitely am a strong believer in finding your voice and self-advocating for yourself as a patient, because if you don't, who will?